Good morning everyone. This is Kamikawa Kaelin. A new mutant of the new corona, Omicron strain, was discovered in South Africa, the news flowed. According to the Asahi Shimbun, the world is ready for the emergence of the new coronavirus, Omicron strain. But don't you think it's suspicious? In particular, I can't trust what the Asahi Shimbun says. You don't know anything in detail, right? Is it too much noise? Am I the only one who feels the news like, a wolf has arrived? Immigration restrictions have been tightened in each country, and lockdown will become a reality depending on the spread of infection in the future. However, I don't really understand what kind of virus the Omicron strain has. You're fanning for no reason. World Health Organization, WHO, from previous surveys it was, people who have had corona once are more likely to be reinfected than past mutants. It may be easy to spread rapidly. WHO only says that the infection rate is high. According to materials from the European Centre for Disease Prevention and Control, ECDC, etc. It was, Omicron strains have a number of genetic characteristics identified in mutant strains such as alpha and beta strains. It is more infectious than previous mutants, even for those who have had it once or who have been vaccinated. There is a concern that the infection will spread by bypassing the built-in immunity. So, isn't it just a high infection rate? In Europe, the spread of infection by Delta strains is currently serious. In winter, when the virus is easy to spread, more infectious mutants may be added. Quote, "It's just speculation. Under such circumstances, the ECDC has stated that the current level of risk is high or very high. But there are many things we don't know yet. Don't you understand? In the end, the spread of Omicron strains in South Africa and elsewhere, there is still the possibility that it is happening exceptionally in some areas. At this stage, it cannot be concluded that it is more infectious than the Delta strain. Whether the current vaccine is really ineffective, further investigation is needed, including in vitro experiments. The work will take another 2 to 3 weeks, ECDC. According to a report from South Africa, some people infected with this mutant are asymptomatic. So far, it has not been pointed out that it is particularly likely to cause aggravation of patients. Associate Professor Kei Sato, Virology, Institute of Medical Science, University of Tokyo. What mutations are happening? How many patients are out there? At present, there is too little detailed information such as. At this stage, it's difficult to assess how vigilant you should be. Meanwhile, according to Reuters, Pfizer, a major U.S. pharmaceutical company, and BioNTech, a German biotechnology company, have already started research on mutant strains. If needed, new vaccines are expected to ship in about 100 days. The U.S. biotechnology company Moderna also confirmed the effect on the vaccine effect, and it has indicated its intention to proceed with the development of a vaccine specialized for this mutant strain. Well, so far, only high infectivity, nothing is known. It's too much fuss. If the number of deaths has increased dramatically in the field, I don't know, but the locals are pinning and traveling abroad without symptoms, right? Doesn't it look like the severity rate is high by any means? So far, I've been fooled by this kind of gay news for 2 years. I can't believe it. In South Africa, the average number of new infections per day increased by more than 3,900 in 3 weeks. 19% increase from the previous peak. The number of infected people in South Africa is on the rise, with an average of 4,196 new cases reported daily. He had a peak daily average number of people, reaching 21% on July 8. However, at present, only 2 people die a day. Since the start of the pandemic, 2,958,548 people have been infected and 89,791 people have died in the country. Apparently. You won't know the details until 2 weeks have passed. Whether to ban entry before the results come out, or to ban entry after seeing the results 2 weeks later is a matter of judgment. In any case, I don't think the waterfront operation will work. As always, I think we have to accept it slowly and coexist slowly. That's all.
father, son, and Hassan Poche.